Good morning. My name is Mohammed Salah Dagane. I'm the County Director of Health in charge of preventive and promotive, that is Public Health Department in Garissa County. Our county is one of the counties that is in ASAL counties, hard to reach counties, and we have also been affected by this pandemic, COVID-19, and since we were affected so much, but thanks God that things are going on very well. So in times of communities living in the remote areas, and how we have managed to reach them is that because of some of the logistics and the cold chain management that is required, it may not be an easy, but the county has planned to ride on its current existing structures in the sub-counties to reach the communities. Also, we have distributed our vaccines to the 7 sub-counties of Garissa County, that is Hulugo, Ijara, Burra, Garissa, Lagdera, Balambala, and Dadaab, and also the refugee communities, and we have integrated this vaccines distribution and also inoculation of the people on the routine outreach, which we normally conduct to reach the nomadic population, which is unreachable. In the remote areas where women are normally the most people who are there, because they take care of the animals and all others, we have established structured health promotion programs. That means we are doing a lot of social mobilization at the county level and at the sub-county level. And in every sub-county, we have health promotion officers who are actually the 7 sub-counties who are also dealing with this issue of promotions, and also on mobilization, communication and mobilization to make sure that everybody is reached. We also ride on the community health strategy. We have almost 200 community units in this county, and we have community health volunteers in every community unit and in every village, and these are the people who give health education to the community, because they live within the community in the community units, so they are able to also make sure that the messages reaches there. Lastly, we have a stakeholders engagement approaches whereby we target religious leaders in the mosques, we administration, women, and the youth groups. Also, we target them. So far, we have received about 6,000 doses of the vaccine, AstraZeneca, and we have used all of them, and it was very successful. Actually, as we are talking now, we have our first doses we have given to the 6,000, and some of the second doses, and we are waiting for more. On the reaching of the communities which are far-flanked in the areas, and whether we use the issue of the solar on camels, I think that is a very, very important thing, that if we are able to activate that one, we put some solar panels on the camels, so for the refrigerations, and we move with the community. But this one is one of the best innovative in this kind of this, or not only this, in even the routine immunizations, it is going to help us. But so far, we have not been practicing this kind of thing. What we do is that we do our routine immunizations within the facilities. And also what we have done is that we have integrated the routine immunization into, the COVID vaccine into the routine immunization. So during the outreach, when we do outreaches, that is why we integrate. And we use, instead of donkeys, we use motorbikes. But if you use donkeys, it's going to be even much better, because the donkeys reach where motorbikes are not even able to reach. And we also have a robust health education programs in all the sub-counties. So I think that is what I have for now. One of the biggest challenges that we have is that along the border is that the border is porous and people are coming in. Although the border is closed, but there's a lot of human beings who are coming in. So we were requesting whether we could establish what we call a point of entry, maybe in Leboy, Amuma, Hulugo, those places along the border, so that we establish a quarantine center. We have our staffs there. We have the hospitals, the dispensaries in those areas. We also deploy some public health officers and also some nurses in those areas to do the immunization and the referral, to make sure that all those people are screened and they are referred. And also, we have also done our testing now in Garissa County Referral Hospital, so that when we have a COVID patients, we just do the test here. But it's a big challenge because the border is closed. People sneak into the border, and by the time you realize somebody is there, is already in the refugee camps or maybe even in further places. But we are trying our best. Anybody who needs to be tested, we have the equipment within the border, but the border area, and that's where we test. But the big challenge is that how to capture. Maybe what we are assuming is that out of the many people who come through those borders from Somalia or crossing to Somalia, the number of people we capture are very minimal compared to if the border was closed and then we had a specific border entry points, which we don't have now. There's a challenge on the vaccines, especially at the border with these Al-Shabaab. And also the other issue is also the challenge of the cold chain. What we have said is that at the moment we are doing the vaccinations at the main facilities at the sub-counties, and also maybe along we also do it at the 3 main refugee hospitals in Dagahle, Ifo, and Hagadera. But we would like to roll out the program to the dispensaries and the health centers. But of course, the challenge of security is there. But hopefully, we will normally liaise with the security people along the border, and the Kenya Army and the GSU and those people. So in case of anything, we always assist one another. And so far, as much as I can remember, we have never had any incidents whereby health workers were attacked when they were doing the immunization, except one place in the county, which is far from the border. But so far, our health workers have not been either attacked or abducted or something. But we are very apprehensive about the security system because we are really fearing.